Welcome back. So I've been getting requests on to make videos on microbiology. So I'll be starting with parasitology, and I won't be covering the entire thing, but we'll be focusing on some high-yield questions. So firstly, I'll be talking about malaria. So here we need to know that malaria is caused by the plasmodium. It's caused by plasmodium. Before going any further, I'll quickly discuss how the life cycle works. So here you have the life cycle of malarial parasite. These are small and easy topics, so I'll be going fast. So firstly, as you can see, as soon as the sporozoite enters the man, it enters the human being, it enters and then it forms the pre-erythrocyte phase cycle. And important thing is this is in liver, so we need to know this. Then it is transformed into merozoites. Next moves on as erythrocytic cycle, and this is in RBC. Next forms components such as the trophozoites, seijont and merozoites. Trophozoites, seijont and merozoites. Then there is formation of gametogeny. The process takes place, then it leads to, there are a sequence of procedures. Afterwards it leads to zygote, and this again forms ookinete. This forms oocyst. Then sporozoites, what happens, the mosquito transfers it from itself to that of another human being. So now I'll be focusing on this stage, what exactly happens here. So now going here, I spoke about the gametogeny. So here what is happening is there is microgametocyte and macrogametocyte. This in mosquito, again we see the same, that is microgametocyte and macrogametocyte. So what this forms is, microgametocyte forms microgamete. This forms macrogamete. Now this together forms and results in fertilization. Later on it forms zygote. That's how I have continued here. So quickly summarizing the cycle, the sporozoites, it infects the man. Then we have the pre-erythrocytic cycle, and important to know is it takes place in liver. And then the sequence should be well known, that is merozoites, and then erythrocytic cycle takes place in RBCs, then formation of trophozoite, seizoid, and merozoite. Then there's a process of gametogeny, and that we have clearly seen here. That is formation of micro and macrogamete, which leads to gametocyte, which leads to microgamete and macrogamete, and then it leads to fertilization and zygote. And after the process of fertilization and zygote, we look at this step, that is, there is zygote formation, then ookinete, oocyst, and then sporozoite, and then again it is transferred by the mosquito from a infected person to a normal individual. So that was how the life cycle. Now we'll be just another important point to note is some host. So in such a case, the intermediate host in the life cycle is the man or the human. Next, other important point would be to know who is the definitive host. So in this case, definitive host is nothing but the mosquito is the definitive host. In short, I have explained the life cycle, but in short, we can classify the stages as pre-erythrocytic, erythrocytic, next gametogony, next is exoerythrocytic, schizogony. So these are the steps. Questions can be framed in such pattern as well. So we need to know the sequence and the order. Now, moving further, this is the basic that we need to know. And looking at some laboratory diagnosis. In case of lab diagnosis, Plasmodium species such as, just write it down, Plasmodium species such as falciparum, what we notice is there is ring forms and gametocyte is seen. Whereas the same case in place of Plasmodium vivax, Plasmodium malariae, and ovale. So in such cases, all asexual erythrocytic stages. So this mainly includes the ring forms, trophozoites, and schizones. Now, moving ahead, we are looking at Plasmodium falciparum. So, to confirm this, what is seen is multiple rings and with Acoliforms. Acoliforms are nothing but the nucleus is pushed to the center, to the periphery. So an appearance like that is known as acoliforms. Another few MCQs that can be framed would be Schuffner dots. So this Schuffner dots are in RBCs, are seen in cases of Plasmodium vivax and Plasmodium ovale. Moving ahead, the other dots that can be seen are Morer's dots and Zeeman dots. So these dots are seen in cases of RBC in Plasmodium falciparum and Plasmodium malariae. And another interesting thing to note is that there is, in case of Plasmodium falciparum, there is no enlargement of the RBC. So there is no enlargement. Another criteria would be to see under the fluorescent microscope. So that is also a possibility. Fluorescent microscopy can be used, and to be more specific, it uses the Kawamoto technique. Okay, now going more deep, here what we see is acridine orange is used, and what change we see is that the nuclear DNA is stained green, and the other part is the cytoplasm. What is seen here is it goes, the cytoplasmic RNA turns red. So that's an important point to note. And looking at what is QBC. QBC is nothing but the quantitative Buffy coat. So here this QBC has an important sign. So it is the blood collected in the QBC tube. What happens is we are coating it with the fluorescent dyes, and then what we are doing is we are centrifuging it. Now this Buffy, so what is achieved is we are getting a Buffy coat, and this is examined under microscope. Yes, microscope. And what is seen is here, which stain with acridine orange will appear brilliant green. So here another thing to note is this method has a higher priority, that is the sensitivity is greater than that of the thick blood smear. So this is an important point. Next, we also have the rapid diagnostic test that can be done. So not going in detail, but mentioning a few that is used. There is the immunochromatographic methods. So here what is used is the test strip is used containing monoclonal antibodies, and due to the reaction, the precipitate is formed, that is antigen antibody reaction. And there includes other tests such as the parasite F test. This is to be known. This is a commercial test. And also there is something known as the lactate dehydrogenase test. That are used. Next, we can include the serological test. So here there is indirect immunofluorescent test, indirect hemagglutination assay, enzyme linked immunosorbent assay. So it is indirect immunofluorescent test, indirect hemagglutination assay, and enzyme linked immunosorbent assay. Next, we can also do by checking the DNA probes. That is, there is DNA probes. And next, we can have the PCR. So PCR separately can be asked as a MCQ. So there we need to know the steps. So that is nothing but denaturation, then annealing and extension. These are the important steps that needs to be known. Here the bonds are broken. Here the primer is attached, and here it extends, and then you have Thermophilus aquaticus, which is used. Okay, so not going into detail. Now looking at the treatment, this is again going a bit of pharmacology. There is a big classification already given, but I'll be just concentrating on the very few drugs that are given. That is, we can give chloroquine in case of acute, and in case of resistant, people who are resistant, what can be done is we can administer mefloquine, can be given. And now other drugs that can be administered are artemisinin, and their derivatives can be given, and they are used for mefloquine resistant as well as given for multi-drug resistant as well. So these are some important things to note. Now we'll be jumping to another topic. Some important we need to know, that is the tapeworm, commonly known as the Taenia species. So here the Taenia saginata and we have the Taenia solium. So the Taenia saginata is also known as the beef tapeworm. I'll quickly write it down. So learning about Taenia, so this is nothing but the tapeworm. Here it's also divided into saginata. Second, it's also divided into solium. So now I'll be discussing about solium. So as mentioned, I will be quickly going through the cycle. So this is the life cycle. In the life cycle, what's happening is we are starting with the adult worm, which is hooked in the small intestine. So now what happens is this eggs or the gravida, it's also known as gravid proglottids. So what we see is this is in the feces. Next, what is seen in this stage is it is ingested by the intermediate host. So in this case it's the pork, the pig, and then it goes to the oncosphere. What happens? The oncosphere, it hatches out and it penetrates the gut wall. After penetrating the gut wall, it goes into the systemic circulation. Then what happens is it's filtered from systemic circulation and goes into the muscular tissue. And after going again into the muscular tissue, it is ingested and we see that the scolex of Cystericus, it evaginates and then it attaches to the gut wall. And this cycle continues. So let us quickly go through. So we started with the adult in the small intestine. Then moving on, the egg or the gravid proglottids are present in the feces, and then we have seen that it is ingested by the intermediate host, and then the oncosphere hatches out and penetrates through the gut wall, and the systemic circulation takes place, and then it is filtered from the system circulation and into the muscular tissue, and then it is ingested and the scolex of Cystericus evaginates and it attaches to the gut wall, and again it goes to the adult, that is, it goes into the human intestine. Now looking about quickly on some morphological features. Morphology. So here what we are seeing is there are some hooklets and suckers. So looking at the adult worm, so these values we might want to know. It's 2 to 3 meters, not centimeter, not millimeter, it's meters in length. And it contains of 3 parts. So what are they? One is scolex, next is neck, next is proglottids. So there are 3 parts. Now the scolex or the head is globular in shape. It's globular and has 4 circular suckers. Now looking at the head, so the head, it contains a rostulum rostrum, and it is armed with double, this needs to be known, double row of hooklets, and the neck is short. So here the neck part, what is need to know is it is short. And now looking at the eggs. Here the eggs are characterized. These are nothing but it is same and similar to that of the Tinea saginata. So to quickly mention, the eggs are spherical, they are bile stained, and what we are seeing is the inner embryospore is thick walled, is thick walled, and radially striated, and it is brown colored. And they do not float, don't float in saturated solution of common salt, and mainly infected in cattle. So these are some points. So they are spherical and bile stained. Their inner embryospore is thick walled and radiating. It has radiations and it is brown colored, and they do not float in a saturated solution of common salt and is infected in cattle. Now I'll quickly draw the diagram so that it's easier to imagine. So this is how it looks. There are 4 suckers. This is the rough diagram and this is how it looks. So here these are nothing but the suckers, and then here you have the hooklets. This is a rough diagram how it is supposed to be. So that's how it is. Now we'll be quickly looking at some other important MCQs. So the another concept is of cis circus cellulose. So here the cysticercosis cellulose is nothing but the larval stage, and it is also known as the bladder worm, this stage. And here it develops in the muscles of intermediate host. So muscles. So this muscles, it is not in all the muscles but in specific locations like the tongue, can be in the neck or the shoulder, and ham. So these are the top sites where it is present, that is the tongue, neck, shoulder and ham. And looking at the cardiac muscle, surprisingly the cardiac muscle is affected, and a mature cyst, looking at the shape, mature cyst, what is seen is that it is opalescent. And ellipsoidal body. It has long axis of cyst and parallel to the muscle fiber. Going ahead, the same, a dense white spot is also seen, and it is present at the side of the scolex. And with its hooks and suckers are invaginated. So this is a point to note, a white spot is seen. Now there is another concept of cysticercosis. This is the same way where the man gets infected. So as you know, the source is through contaminated water or food, or by eating uncooked vegetables as well. So here these types are mainly found in any organ, but most commonly it is found in the subcutaneous tissues. Now moving further, we will be looking at some clinical features of how patient will present. So looking at the clinical features, patient can, mainly it is asymptomatic, and it can present with abdominal discomfort, chronic indigestion, can lead to anemia, and intestinal disorders. And what is need to be known is visible nodules. Nodules are seen in subcutaneous tissues, in subcutaneous tissues and muscles. Moving ahead, looking at the lab diagnosis. These topics are very important. So in case of intestinal examination, this can be done. This is by stool examination, and also by molecular methods, and this is by DNA probe as well as PCR. Next, there is also some, in case of diagnosis of cystericosis, what need to be known is there is biopsy examination of subcutaneous tissue. Then there is also X-ray of the skull. It is important to know what X-ray is taken. So here it is of the skull and the soft tissues. Also, the CT scan is taken. This is for the calcified cyst. Next, MRIs also are taken. And what we need to know is the MRI is superior to that of the CT scan. Next, as all diseases have, we can take the serological test, and it is used for, the examples here are indirect heme agglutination assay, there is indirect fluorescent antibody, and then enzyme linked immunosorbent assay. Other tests that can be performed are the antigen detection, that is by ELISA. We can also have the PCR, polymerase chain reaction, as well as knowing the history well, history of the patient in case of any intestinal teniasis. So let me recap. So looking at the stage of the intestinal amoebiasis, teniasis. So in such a case, intestinal teniasis, what we do is firstly stool examination. Next, we can do by molecular methods, which includes DNA probe and PCR. Now, diagnosis of cystericosis, the important is biopsy, examination of subcutaneous tissue. Then X-ray, that includes skull and soft tissue. Then CT scan, which includes calcified cyst. Then MRI is always greater than CT scan, that should be known. And then serological tests such as IHA, that is nothing but the indirect hemoagglutination assay. Then in indirect fluorescent antibody, as well as the enzyme linked immunosorbent assay. And then we have the antigen detection, that is by ELISA, and then PCR, and also the history of intestinal teniasis should be ruled out. Next, moving on, looking at the treatment, again we have a lot, but we'll be focusing on a few drugs. So here we have the praziquantel, as well as the niclosamide. These are most commonly used, praziquantel and niclosamide, and it is used as a treatment of the human tapeworm infection. And what is given is a single dose, and this dose is given with 2 grams, and that is nothing but 4 tablets of 500 milligram. There might be a slight variation depending on the location you are. So this is the main treatment that is given. There's praziquantel and niclosamide. And in case of cystericosis, cirrhosis. So in such a case, albendazole and praziquantel is used. Okay. Next, what we see is excision can also be done. This is in case of severe case of cysticercosis. Okay. So just revising, the cysticercosis, albendazole and praziquantel is mainly used. Now we'll be again jumping to another topic, that is we'll be looking at this topic, that is H. nana, that is Hymenelepis nana. So here firstly I'll be showing you how it looks, the diagram. This can be asked, we need to know the each and every labeling of this diagram. So this is how the structure looks. There is the polar filaments. These are nothing but polar filaments. Next, there are the inner membrane as well. Inner membrane. There is also polar thickening that is seen. We can see the oncosphere as well. We can see the yolk granules. And then the yolk filaments, the polar filaments, that is already done. So the points being polar filaments, inner membrane, oncosphere, polar thickening, and then the yolk granules. Now quickly looking at the life cycle of H. nana. So we always start from the man infected stage. The man gets infected by ingestion of eggs, and this is by fecal or oral route. Next, what happens is the oncosphere is liberated. If you see that it's similar to that of the Taenia solium, oncosphere is liberated, and then what happens is it takes about say 5 days, and then the cysticercoid larva is seen. And then what happens is in 2 weeks time or more, we see that there is formation of the adult worm in the small intestine. Next, we see that the eggs or the proglottids in the feces. Next, we see that the rat flea eats the eggs of H. nana. And then cysticercoid larva is formed. This is another spectrum of the cycle, and then we can also see the rodents get infected. Now looking at the main cycle, from the eggs it jumps, that is the eggs may hatch out in this intestine. So it can hatch in intestine, and as well, before it comes in the feces, it hatches out in the intestine, and the embryo is liberated, and it invades the intestinal wall, and then this cycle continues. Now, looking at another aspect of the cycle, we can see the external autoinfection pathway. From here, it directly goes to the external infective pathway, autoinfection. So this is where it goes to the man. So I'll just be summarizing. So here, as we usually start, the man is infected by the ingestion of the eggs through the fecal or oral route, and the oncosphere is liberated. Say about in 5 days, the cystericoid larva is seen, and then in about 2 weeks or more, the adult worm is formed in the intestine, and then the eggs and proglottis are present in the feces, and it is taken by the rat, and it causes infections in the rats, that's the rodents. Another spectrum is it hatches in the intestine, and then the embryo is liberated, and then it invades the intestinal wall. And looking at the main cycle, what happens is the egg and proglotid in the feces, it is external autoinfection takes place, and it is again ingested by that of the man, and through the fecal or the oral route. So that is how it is done. Now, quickly looking at the H-Nana, we drew the diagram, but discussing further about the diagram, let me quickly show you. I'm not labeling it since it's already done. So this was the rough diagram how we drew the H-Nana with the polar filaments. It is known as the here. Next, we'll be looking at, this is nothing but the yolk granules. Now, just discussing how the morphology looks. The egg is basically, it is spheroidal, and it is 30 to 45 micrometer. It is thin, colorless outer membrane, and it contains the inner membrane as well. So this inner membrane encloses the oncosphere, and then the space between the two, they have yolk granules present that are present, and 4 to 8 polar filaments can arise. There are 4 to 8 polar filaments that are present. Now, this is the structure of the egg that we have discussed so far. Now we'll be moving on to the adult worm. So looking at the adult worm, so this is the structure. Okay, so here we have suckers. So here there are single row of hooklets. So these are nothing but the suckers. Scolex is this. Next, we also have the neck part. Next, we also have the proglottids segments. And this is nothing but the gravid proglottid. Now, looking at what this is about each individually. This scolex, it is globular and has 4 suckers, as we have seen. Next, the neck is long, slender, and it is present on the posterior to that of scolex. Next we have seen this part, that is the strobila. So this strobila is present after the neck, and it consists of 202 or more proglottids. So these proglottids are broader than long. They have increased breadth. And another interesting point to note is that the lifespan is about 2 weeks. Since we are done with this, we'll be quickly looking at the treatment aspect and how it is treated. Now, looking at the lab diagnosis, it is demonstrated by the eggs in feces. So by studying the eggs in feces, this is one aspect. This is by the direct microscopy, and also by salt flotation and formal ether may be used. Now, looking at the treatment aspect. In case of the treatment aspect, praziquantel is used, and also niclosamide can be used. So here also we need to know the priority, that is praziquantel is preferred more than that of niclosamide. And as common, we can be asked about some clinical aspects like how to prevent. So how to stop? This is done by personal hygiene, then avoid contamination of food, avoid the contaminated food, and then by controlling the rodents. This is a very important aspect, that is the rodent control should be done. Now quickly just summarizing the lab diagnosis. This is the lab diagnosis, and then here firstly we need to know the presence of the egg in feces. We saw the diagram earlier, and then the direct microscopy by seeing the eggs in the direct microscopy. Next we have the salt flotation and formal ether. It can also be used. Treatment is by praziquantel and niclosamide, and what we need to know is praziquantel is highly preferred than that of niclosamide. And then how do you stop this infection? This is by maintaining a personal hygiene and sanitary improvements, as well as the avoiding the contamination of food, and as well as the rodents. So next, we have come to the end of part 1. Next, I'll be continuing in part 2. Thank you.